Let's talk about arthritis. Standard medicine, anti-inflammatories, the NSAIDs, the non-steroidal anti-inflammatory medications, drugs. One of the highest death rates in medicine is because of GI bleeds. And the GI bleed is caused because of the NSAIDs and the aspirins, those medications that are being taken in that cause GI upset and distress. Range of motion and physical therapy for arthritis. If it's rheumatoid arthritis, then immune suppressants. They will use cancer medications to try to reduce the autoimmune response. Methotrexate being one of those, which has side effects of hepatotoxicity, which is liver toxicity, bone marrow suppression, ulcers, lung inflammation, blood vessel inflammation. They'll use antimalarials, which has side effects of retinal lesions, loss of vision. They'll use gold, side effects being kidney and bone marrow toxicity, and rarely surgery. What do we use as anti-inflammatories? Safer products. MSM, all those ones we talked about before, curcumin, ginger, and ginger root, boswellia. And in fact, boswellia for osteoarthritis competes very favorably with the anti-inflammatories, the NSAIDs that standard medicine uses. Bromelain is an enzyme that breaks down some of those products that build up in the tissue, so those proteins. We supply the building blocks of cartilage, which is the glucosamine. And there was 3 recent studies show that if you compare glucosamine with glucosamine, which actually builds tissue, and compares it with the anti-inflammatories, that the effect on pain management is the same. And yet, we're using a product that can actually build cartilage tissue. We have frequency generators, which can emit anti-inflammatory frequencies in the joints to reduce the inflammatory reaction. I'm amazed at how many joint problems are muscle-related. When I'm starting to play basketball a couple times a week, and I started to get some knee pain. It's in the same knee that I had surgery on 30 years ago for a meniscal tear. So I thought, probably that old surgery injury is starting to come back, and I'm not going to be able to play basketball anymore. So I had the massage therapist look at that knee, because they're pretty bright. They certainly know the muscles. And she found the muscle that was causing the stretch on that knee, worked it out. Now, those of you who have tight muscles and you have the massage therapist work it out, you know the pain that they inflict upon you to get that done. But when she was done, and we only had about 5 or 10 minutes, she worked on this outside gastrocnemius muscle that was pulling right on that side of the tendon. I got up from off the table for about 5 to 8 minutes of massage therapy on that one muscle. The pain was 100% gone. I am absolutely amazed at how much knee, hip, shoulder, feet, ankles, wrist pain is because of muscle imbalances. We have some energy techniques, acupuncture, Jinshin-Jitsu, craniosacral, that can also get energy flowing so that healing can take place with these arthritic joints.